warning signs of relapse, and I'm going to speak a little bit to psychosis at the end, but I'm not going to get too stuck on the idea um, towards the end. We'll just see how much we get through in terms of the early warning signs of relapse. Okay. So I thought I'd start off with maybe just around the misconceptions of relapse. So we often think that relapse is quite sudden, and that's it sort of happens in the blink of an eye, and then our loved ones find themselves inactive again. I think sometimes we just think of this idea where, they have a bad day, and all of a sudden they find themselves in a bar alone, contemplating drinking or using, right? And very often that's not the case. Very often, this relapse for them has been happening for some weeks or some months. Okay. It can happen quite sudden in terms of like the last stages of relapse. But in terms of getting to that point, a lot really had to happen for them to find themselves in that situation. Okay, so most of the time it's not sudden. It's rather a gradual process that plays on various aspects of our loved ones suffering from addiction. Uh, the relapse normally plays out in three aspects of our lives. And before we get into these aspects, I'm going to speak to some of the triggers that occur. So I want you to think a bit of relapse, how it occurs as a bit of a rolling stone. And keep in mind this metaphor around stones, because I do have this little picture here, of an actual rolling stone. But I think I have also well, I have two pictures here at the bottom that also just speak to the different kinds of stabilities we need in terms of these stones. Um, you know, th- some of our loved ones can have many of their pillars, in check, but you find that maybe they're not as strong or as sturdy as they could be. And these are some of the precursors to relapse, if that makes sense. Okay. So we're just going to briefly speak about some of the triggers that happen before relapse. So the idea here is that, you know, this doesn't occur in a bubble. You don't just all of a sudden find yourself sitting in the bar anticipating a drink. Um, sure. Yeah, as I was saying, this is quite a gradual process. Um, One doesn't find themselves just sitting in the bar all of a sudden contemplating drinking. And so what generally occurs and how it really starts out is it starts out with some kind of trigger, some kind of event that puts them on the path towards relapse. And it can be small. It doesn't have to be something big. Um, so yeah, just in terms of trigger events, our loved ones are never cured of their cravings after treatment. So they may walk out of primary care here, still craving. In all likelihood, they will walk out of primary treatment with some sort of craving, and that's why we um, really advocate so much for term treatment, because 21 days is not enough to restructure and rethink and almost change the chemistry of the brain to actually understand the cravings that they're feeling. Okay, so rather when they leave here, they're given the tools to cope with those cravings and triggers in order to resist them and stay in long-term recovery. So recovery is a lifelong process. One part of the process is knowing the triggers that often lead towards one's active addictions. So triggers in this sense can be either internal, external, or both. Internal triggers are normally familiar thoughts and feelings that arise in our daily experiences and cause disruptions to our daily lives due to their intensity. Okay. And then external triggers are the familiar people, places, routines, and things that often create chaos in our daily life. Some of the common triggers include shame, guilt, anger, regret, depression and anxiety, inconsistency and disorganization, a loss of control, heartbreak, job loss, grief, stress, fear, feeling unsafe or misunderstood, specific places, homes, streets, cities, countries, some trauma, abuse, conflicts or aggression, feeling judged, attacked, and invalidated, familiar sights, smells, or tastes, news, stories, books, posts, videos, invasive, often obsessive memories. And so I think very often one of the difficulties um, with these triggers is, let's take, for example, anxiety. I was actually having a discussion with a colleague today around, when is the anxiety helpful and when is it actually a trigger event? Because I imagine some of the anxiety that our loved ones experience actually keeps them out of active addiction. For example, I don't want to relapse. I'm worried about relapse. That's a um, healthy kind of anxiety, right? I should go to meetings. I don't want to be late for meetings. I don't want to be late for work. I don't want crisis to ensue in my life. That to me is an exceptionally healthy kind of anxiety, right? Where it becomes rather towards the more triggering side is when it does become unmanageable. And I think the key word always in terms of addiction is unmanageability and the powerlessness. It's when that anxiety begins to control their lives in some sense. Okay. So many of these trigger events, don't think of them just as black and white, right? Like feeling judged, for example. There are healthy things around feeling judged. Um, we can't always be misunderstood. We can't always be understood. In fact, more often than not, we are going to be misunderstood. And so, what I am also trying to really relay is that a lot of these trigger events are completely unavoidable. Um, for instance, you can't decide what comes on the news. You can't decide what posts all of a sudden you come across while, um, you know, scrolling on Instagram. And I think a great example for me was a couple of years ago. I knew of a story of someone who got quite went through quite a traumatic event, and while that traumatic event was occurring, 702, the introduction on the radio was playing. And for years and years, whenever that, they were walking in the shop, um, whether they were, driving with a friend or something, and, that would play, that was a real trigger for them. And that can't be controlled in some sense, right? Being exposed to these triggers. But what can be controlled or what can be at least worked through on some level is how you react to these triggers, right? And that's why for us here we work so much with thoughts and feelings and behaviors because um, we can't really control how we're reacting to this um, really intense experience to the 702 broadcast, and we can't really control the thoughts that it's bringing up and the memories it's bringing up for us, right? But we can, on some level, do certain things to, work through how we react to that. Okay. So, some of the warning signs of relapse. These triggers are by no means seen as an excuse to use or abuse substances, but it's important to note that using and abusing substances often functions to suppress, avoid, and escape or enhance and intensify. Just excuse me for a second. Sorry, needed to mute this phone. Let me just mute it more properly. Sorry, a phone just went off in the office. So yeah, by no means is a trigger simply just an excuse to be using or abusing, but always remember that very often these triggers or abusing and using substance often functions to suppress, avoid, and escape or enhance, intensify, and reinforce certain thoughts, feelings, and behaviors. Um, so a great example in terms of suppression, I don't want to feel this anxiety, let me use, or I don't want to feel this anxiety, let me use so that I can feel happy, right? That would be the enhancing side of using, and the suppressant side is obviously avoiding the intense emotion. Okay. So addiction is a chronic disease similar to that of other chronic conditions like diabetes. And when people stop their treatment plans for chronic conditions, they're more likely to relapse. Same case here. You wouldn't stop using your diabetic medication because in all eventuality, you would end up being quite sick and ill and your life would become unmanageable. And so the important here with triggers and thinking about triggers is to make sure that you are following a very well thought out um, treatment plan that also often relies on social structures because one of the biggest problems is we think, okay, here's a treatment plan, all you have to do is just now put it in place. And the reality is very often when you reach out into the world, um, those plans kind of just are so easily forgotten, and it's so easy to jump back into your familiar way of doing things, right? Which is to avoid, escape, or enhance and intensify, right? And so the important thing in terms of any treatment plan is to always consider social structures and social support, and how that social support can best enhance that treatment plan. Okay. So relapse, most importantly, is a process. It's not an event. Relapse generally starts weeks or months prior to the actual physical relapse. There are three stages of relapse that we're going to be talking a bit about tonight, and that is an emotional relapse, a mental relapse, and a physical relapse. Okay, so in terms of emotional relapse, at this stage of relapse can be difficult to spot at times because of the nature of emotions, but it can often be observed through loved ones' behaviors. Although, really, what I'm saying there is that although you can't really tap into what their emotional state is very often, we can observe some of their emotional state through their behaviors. And how that will look is very often mood swings, isolation. Isolation can also be a tricky one because very often our loved ones might be attending meetings. They may be telling us that they're attending meetings, but the isolation is still occurring in terms of, possible lies around the meeting. So you may think that, wow, this doesn't really look like isolation, but in actuality, they're actually not attending the meetings you think they are and are still isolating. So isolation can always be, it can be a very easy one to pick up sometimes, depending on your loved one, but it can also be an incredibly hard one because they can still also be attending meetings, but then maybe perhaps not even sharing in meetings. So another example is poor sleep schedule, unhealthy eating habits, poor self-care, not going to meetings but not participating, holding in one's thoughts and feelings, neglecting responsibilities, anxiety, intolerance. This can be intolerance of frustration, intolerance of, small events in their life. For me, that's always a big one, is intolerance, because very often our intolerance is, the more emotional we are, the lower our tolerance levels become. And so you might find that the smallest little thing that would normally be tolerable is completely intolerant. So that's a good one to look out for. Anger, defensiveness, not seeking out help, neglecting hygiene, not using coping mechanisms to manage complex emotions, and focusing on others. Basically, an emotional relapse speaks very much to just the what can we see that we've seen in the past, right? And really, the cure in many ways towards or the let's say the prevention in many ways in terms of emotional relapses is basic self-care. Are you sleeping right? Are you eating right? Are you attending enough meetings? Are you cleaning right? Are you following through on all your responsibilities? Are you making sure your emotions are, you know, not becoming to the point of unmanageability either? Um, just overall, are you taking care of yourself? In terms of emotional relapses, denial is one of the biggest parts of an emotional relapse. During this stage, very little thinking about using occurs. So they'll be in a state where, they may be kind of lashing out with irritation, and they may sort of be sort of more on the defensive side, but they're not necessarily at this point thinking about using, right? Sometimes it's the furthest thing in their minds. Our loved ones at this point may remember their last relapse and don't want to go back there. Yet everything that is occurring in terms of their emotions and the behaviors are setting one up for relapse down the road. This is why denial is such a crucial barrier to um, break past for recovery. Because in many ways, their feelings and behaviors are not really congruent with their thought processes. So the thought process here is saying, hang on, I'm still in recovery. I don't want to relapse. I'm still in recovery. I don't want to relapse. But everything about their behavior and emotion is kind of pointing towards the way that they were inactive, if that makes sense. And so it's very important to, I think, because in terms of relapse, emotional relapse is really where you want to target with your loved ones, or it's where you want to, it's probably where the most effective prevention occurs, um, because it's also the most easily dealt with. It's just as much as exploring your emotions, sharing that experience. Um, and so, you know, this is really where the most crucial aspect of prevention actually occurs. And so breaking through that denial around like, no, but I'm not thinking about it. I'm not thinking about it. And really pointing out, yes, you may not be thinking about it, but everything around you is kind of pointing towards, you about to be using. And it's about really them getting to that point to being like, you're right, I'm not actually really taking care of myself or taking care of my recovery or putting my recovery first, right? I'm letting the unmanageability and the powerlessness sort of ensue in my life. And so it's to really speak to that at the earliest point possible and keep that in check. So living in an emotional relapse for too long often leaves one feeling uncomfortable in their own skin. And this is when thoughts start shifting towards using in order to escape. And this is when we start thinking about mental relapses. So at this stage, this stage is best described as an inner turmoil. A war almost rages on in one's mind. Part of oneself wants to use desperately, but the other part doesn't want to because of the unmanageability and chaos that ensues. Initially, in this phase, one might just be idly thinking about using or entertaining the idea. As the inner war progresses, one's thinking becomes more resolute to use. Some of the signs of mental relapse are thinking about places, people, and things that they used to hang out with, glamorizing the past, lying, spending time with old friends that are still inactive, fantasizing about using or the intoxicant effects, overconfidence. That's a really big one in terms of thinking about using because you will find they're in a state where they're in recovery. They may be going through some kind of emotional turmoil, but that denial is so strong for them that they're saying, "No, that's not me. That could never be me. Look, I'm in recovery. I've been in recovery for 10 years. Why would I use now?" Type of thing. So planning their relapse, especially around theirs or others' schedules, uh, and always thinking about how best not to get caught. Bargaining times, it would be okay to use. So, maybe just this once. Minimizing the consequences of using. Great one around those thoughts is, I might actually have control over it this time. I might actually be able to use successfully this time, without really thinking through, what would most likely ensue, drink after drink after drink, and then thinking they can control their use. At this stage, a person is at high risk for a physical relapse. This is when our loved one's five pillars being in check is so crucial. As very often, this can be the difference between using and not. So, just to remind everyone about the five pillars, it's connecting with a higher power, attending meetings, having a sponsor, and sharing with the sponsor, a service position, and step works. So, these five pillars often serve to help our loved ones play the tape through. And when they're in the stage, most of them have the fantasy that they can control their use this time. And the five pillars sort of serve to help them play the tape all the way through. So, when they're thinking about this tape and when they're really actually thinking about using and this war is raging on in their head, part of them, the problem is that they kind of just cut off the tape. They kind of get to the point where, man, I had so much fun. I really connected with people. I wasn't so lonely. Um, I felt closer to my higher powers, is what a lot of people think as well. And so they get to that point and they go, hmm, um, it's starting to sound like the situation that I was in is a lot better than the situation I'm in right now, which is, emotional, irritable, um, not really coping, not really taking care of myself. And now I'm really starting to obsess about drinking because, at this point, it kind of seems a little bit better than, what was going on in the past, right? And that's very often because they haven't played the tape all the way through. And what the five pillars really do is kind of just say, okay, well, yeah, we hit the crescendo, right? This is where the highlights of the movie really gets, right? You are having the best time of your life, and it kind of seems like it's only up from there. But what the five pillars really remind them of is, uh, the other stuff, the aspects that they're forgetting, the aspects that they really want to forget, the aspects that they're avoiding and suppressing, in order to actually justify their use. And so that's why we really do speak so much towards the five pillars, because, for example, the sponsor, the role that would play out there is, I'm going through a lot emotionally. So already we're kind of in the emotional relapse phase, and saying, well, I've been thinking about using because it seems like a really good idea. And, maybe I should talk this through with my sponsor. And really, there's no sponsor, or at least a good one, that would actually say this is a good idea, because they would remind them and play the tape through, the full tape. And the full tape is that it's not just one drink, and it's not going to get better. It's only going to get worse from there. It can only get worse from there. Okay. And then physical relapse. So physical relapse is the final stage of addiction relapse, and this is when a loved one gives into the urge to use drugs or alcohol. Once they think about using and stop caring about themselves or their recovery, once they stop talking about cravings or sharing their experiences, the thoughts will get stronger and louder until it's eventually screaming in their head. It usually manifests itself with drug-seeking behaviors, or sort of addiction behaviors, such as buying drugs or visiting places where they can be obtained, or sitting in bars looking at menus. This can have severe consequences and detrimental effects on a loved one's recovery progress. Relapse at this point is very hard to stop. This stage is quite sudden and quick. Relapse prevention here is not saying no just before they pick up the drink or drug, though. This is focusing too much on the final stage in terms of relapse prevention. We really want to catch the relapse as early as possible in the thinking phase and in the actual emotional phase, because this is the hardest point to stop. So focusing too much on this final stage often leads to relapse in and of itself. And then I thought, okay, so I was going to speak to maybe if we can open up to questions around the stages of relapse, and then I was going to speak a little bit about psychosis and about this really idea of escape, because I think so often we use this word. No, they're just trying to escape something. No, they're just trying to escape their feeling. They're just trying to escape their past. They're just trying to escape, um, their family environment. They're just trying to escape work. They're just trying to escape school. And we often use this word escape. And I thought maybe we could reflect a bit on what it is that they're actually trying to escape when we look at it as a holistic picture. And then how that relates to psychosis and relapse, because at the end of the day, when we're talking about these trigger events, we're talking about the things that set them up towards this escape that we all talk about, right? So I don't know if we want to first just open up to questions around relapse, or just get straight into escape and then speak to the nature of escape.
Alvin, there is one question.
Sure.
Lisa, do you want to read it?
Absolutely. The question says, what do we do to prevent getting to physical relapse stage at the mental or emotional stage?
Great question. And so I think the crucial thing in terms of the at least, let's say, the emotional stage, is making sure that the loved one is really taking care of themselves, emotionally, physically, spiritually, financially, and are they coping? And what can be done to help them cope more emotionally? How can they be supported best? Recovery is not an easy process, and I think it does require a lot of understanding, but more than that, just a lot of real support. And so, sometimes it can be the difference between, just saying, I'm worried, that's not necessarily the support they may need, as opposed to, wow, things are looking a little bit rough for you right now. What's actually going on? What's actually happening? And, that sudden realization for them, I think, especially in the emotional phase, because they're not thinking, they're just, feeling, um, it kind of just stops them in their tracks. And it's like, yeah, wow, I am actually going through a lot. And that opens up so much avenues to really share. And so I think the most important thing for both stages really, and probably the thing that you want to emphasize the most in terms of your role as loved ones, is sharing as much as possible, attending meetings. And I think especially when you're in the sort of um, thought relapse or the mental relapse, that's when really putting our foot down and putting strong boundaries around attending meetings, around having a sponsor, a service position, and around seeking treatment and help seeking behavior. That's when the real boundaries come into place, in and amongst the other support. And I think, yeah, generally in terms of the emotional support, or at least in the emotional relapse stage, that more emotional support is required as opposed to just, strong boundaries. It's about actually, you know, unconditional positive regard and caring about them and holding them. And when you do start seeing the thoughts and behaviors sort of getting some kind of congruency, especially around the relapse, that's when solid boundaries really need to be in place and saying, now we've gotten to the point where my worry has become real concern, and you need to be doing this, this, and this. Otherwise, these consequences will occur in your life. Cheryl, I don't know if you want to add on to that.
I would like to, please. I think, for most of us that have experienced this before, when they're at that physical stage, there's nothing you can do. Chain them, lock them up, put them in jail, put them in hospital, put them in rehab. So it is crucial that we do, I think along the lines of what Calvin has said, that when we notice a change in the behavior. And I think the one thing that I would like to reiterate is we've got to trust a gut feel. We can't trust our memories, because our memories is where all our trauma sits, living with addiction. And you get a gut feel that something's not right. That's what we've got to start listening to and trusting and talking about on this platform, in other support groups, with your therapist, with your family. Because I think particularly if it's your first or second round in rehab, you don't want to believe that relapse is possible. I remember sitting in a lecture very similar to this and thinking, mine's not gonna. He's been at this long enough. We've done whatever they've asked us to. He's going to be fine. And in my case, I don't think it lasted 20 minutes after he left. So, a relapse is a process. Yeah, it's a process, not the event, as Calvin said. But we are responsible to call them out when we see things that alarm us, because they can't see it. We sometimes joke with our clients saying denial. It's not a river in Egypt. And even if they've been to treatment and they're going to meetings, the denial keeps growing over. And when they're in denial, we want to go back into denial. So I hope both of us helped.
Just another question here. What if our loved ones' lives are on their own and not
Lives on
wanting
their
family
own.
members to interfere, and they're overconfident about their manageability? That is probably the toughest, and I'm sure Cheryl can relate that is probably one of the toughest cases to break, especially when you find that they're working still, that they're paying for their own house, or that they have their own financial freedom, and there's very little consequences to put in place. I find that's the real big difficulty here. What do you actually,
Very much so.
and you find that very often with these people, they also love the isolation. So it's like, well, you're not going to see your family anymore. And they're like, well, sure, no, you know. And so I think that is probably one of the more difficult cases, or more difficult loved ones to deal with, especially with this sort of interference, because I think the first thing that, I feel that when I'm interfering, it feels like this is not my place. This is not my place to say anything, do anything. And I think that these particular cases are very good at making you feel that way, that you are actually the powerless one here, that you actually have no control, and that you shouldn't even be involved, right? And I think that can also sometimes feel like a bit of an affront towards us. It's like, I'm reaching out, and you're saying, don't even get in my business, get away from my business. And it can feel a bit like a slight. And so I think the important thing is to firstly take a big, deep breath and realize that they're playing you and that this is definitely some kind of personality trait that is playing out for them. And it's basically saying to you, go away. And in this particular case, that's exactly what you should not be doing.
Mm-hmm.
And there's such exceptional ways to work around this. A great example, because bear in mind, Claire, that these particular people are at the highest risk of suicide. They are, because they isolate, they're overconfident, they might be in active addiction or active use. No one will know, and their lives have a history of being unmanageable. Okay, and so these people seek out help the least in many cases. And so their risk of suicide, whether it's intentional or unintentional, is quite high. And so one great, barrier around that is to actually just call the ambulance and the police when it becomes to that point. When you are feeling that your loved one is at the point of real risk, right? Of real risk of hurting themselves or others, it's as simple as reaching out to emergency services and letting them take complete control of the situation and making sure that this person is admitted, on a 3-day basis based on the amount of risk they present with. Now, I also hear in your question, what if they, not presenting with this risk? What if they sort of, like you say, just have this overconfidence? And to that, I'd say they're probably in this mental relapse phase, right? And so it's so important to just keep reiterating, for me, the 5 pillars, and reiterating and almost playing through the tape for them, whether they want to hear that or not, or whether you're interfering or not. I think it's so important for you as your family, as the family member, and as the loved one, to play the tape through for them so that they can see what it's done to you as well. Because that's where they're stopping, right? They're stopping there. They're thinking, I don't need anyone. I don't care about anyone. I never needed anyone. But the reality is they always needed someone. And the reality is they're crying out for help. They just don't even know it yet. And so very often at this stage, it's for you as the loved ones, as difficult as it can be, to step in, to feel interfering, not so much that you breach your own boundaries, but to definitely almost play that tape through for them, to show them what is at the end of this bottle. And yeah, I think the word that you mentioned, manageability, speaks so well to that.
Could I back up
Definitely.
as well, please?
Yeah, I mean,
If I read your question clear, I think 2 things stood out for me. One is, when an addict is telling you interfere, you've got to look inward and see, is my behavior interfering or am I being manipulated? Because I think, firstly, you've got to acknowledge majority of family members are codependent. And interfering is, did you go to a meeting? Have you eaten? Are you warm? Did you wear a jacket? That is interfering. But if you're saying to them, I'm really worried about you. You told me you'd phone me at 3 o'clock. You haven't. You phoned, you were abusive. You neglected some responsibilities. That's not interfering. So it's about really being in touch with yourself and your behaviors. And then, again, trusting that gut. Our gut feel, there is times when people are in trouble and they can't verbalize, mom, dad, sister, husband, I'm in trouble. So we pick it up. But I think relapse starts when we notice different behaviors. So if this behavior was common before treatment, one can assume it's going to be similar. But if they go from very needy, very support, needing support, to isolating, then they are in trouble. And the way we speak to them is so important, because we could push them not to relapse. I don't believe anybody has the power to make somebody else relapse, but we can push them where they push their effort button and they just go out. So I think it's really ultimately about open communication, telling them gently how you feel, but being acutely aware of your stuff. Because I think as family members, we all, when they first go into treatment, all of us delegate ourselves to become a policeman. And everything they do, we're watching. We sniff their clothes, we check the time, we watch everything, and we can push people over the edge. So it's finding that fine balance between getting help and support for yourself, supporting them, but not trying to take over their lives. And also one great flag for all of us: they learn spiritual principles in rehab, and they continue spiritual principles in 12-step recovery. If we're not seeing the spiritual principles of humility, honesty, and open-mindedness, this is relapse. May not be using, but they could be in relapse mode. So those are nice, clear beacons that we can use of where they're actually at in their recovery.
And
Yeah,
I think, Cheryl,
sorry, Bless. I was just going to quickly add this, and I think for me, what's saying so strongly about that is that, with these spiritual principles, there's not room for denial. And so if you, and really speaking to what you're saying in terms of this gut feel, if you have the gut feel that this is actual denial, speak to that more than anything. Sorry, Palesa?
I'm just listening to the both of you talk, and I think what comes out strongly for me is the issue of control, right? And I think as a person being in recovery, they want to prove so much that they've got it under control, and that could be self-sabotage. So almost as the family members or the loved ones challenge them on the issue of control, to say, how has it worked out for you in the past to want to be in control? Have you been in control of your addiction, right? Because in their attempt to want to control their recovery process, they want to isolate, they want to prove that they're self-sufficient, and that could really be disastrous for them. So challenge them on the issue of control and how beneficial it's been for them and how it's worked out for them.
And I think it's so interesting because they want to be in control of themselves. We feel like we're losing control. We want to take control of them. And it becomes that spiral of complete unmanageability and powerlessness, because they need to take responsibility. Like for me, control is like a drug. If they're trying to control themselves, they might be using. When we're trying to control them, we're using our drugs. So it's about whose responsibility is what and how to support them. I think it took me years to learn how to support them, because we operate on all our own emotions. We're terrified, we're traumatized, we don't want to go back, we don't trust ourselves. He said this. Is it manipulation? Is it the truth? He needs his space, but what does that mean? Is it because he wants to use, or because he's in trouble? Is he got a girlfriend? So like the crazies come out, and ultimately it's about he's responsible or she's responsible for their recovery, and we're responsible for ours. And how do we chat and communicate and not be in control of anybody? I think there's another question. What were the 3 H's? It's honesty. No, it's how. It's HOW. Honest, open-minded, and willing. But I think, the spiritual principles that are important for recovery is humility, honesty, and open-minded. Open-minded is that control that you're talking about, Palesa, where they don't have to be in control. They can actually listen and go, my loved one's got a point there. And there's the humility. If we say, you know what, I'm worried, and he goes, leave me alone, I know what I'm doing, that's not humble. If they say, you know what, I think I better get myself to a meeting, hey?
Mm.
And you go, yeah, right. That's humble. And honest as, Mom, you crowding me. You phoning me too often. You controlling me. That's healthy.
Mm.
But to say you're interfering, I'd be worried.
And I think for me, you know, there is always this intuition, this feeling around denial, but it's actually really easy to observe. It's actually a behavior in many ways. You know, there's this kind of old adage, oh, you're just denying that you're denying now. Like how far does the denial loop go in some sense? But really, it's just in how willing they are to reflect. You know, bear in mind, many of the stuff you may bring up, many of your worries, many of your anxieties, as Cheryl had said, might just be your own stuff. That's a real reality. But there's also nothing wrong with them getting to the point where they say, it could be that way. I definitely need to think about that. You know, whether it is your stuff or not your stuff, or their stuff or not their stuff, the point is that there is a real willingness to actually think about this, a real openness to think about this. And so you really can, in many ways, just observe the denial. And, you know, if it's so quick to be like, nah, that can't be me, that's you. You're just interfering. You always interfere. You like that. To me, that's such a dismissive, quick, no chance to even reflect on the process. It's not recovery. It's not recovery. And I think so often we see that play out. Cheryl, it's just, no, that can't be me. No, that's just, you know, your stuff. And I think many of you family members here have also seen this play out in conjoints too, right? Where someone might share something and they have a real intense reaction. And I think it's because you're touching something. Most of the time with denial, the reason it comes so strongly is because you're really touching on something and you are holding up a mirror and they don't want to see it. They just don't want to see it. It's too painful. It's too ugly. And it's far easier to just escape. Are there any more questions around this? Okay. So I was going to briefly talk about psychosis, mostly because I think we've been dealing with quite a few patients that have been in sort of a substance-induced psychosis. And I thought, let me not grab or take this on a bit too academically and rather just speak to this in relation to relapse and active addiction, right? So bear in mind that drugs, substances, these are all mind-altering chemicals, and they have mind-altering effects on the brain. And in terms of neurotransmitters and the emotions we feel and the behaviors we act out and how we think and how we reason, it plays such a holistic kind of role in everything that relates to our experience, right? It's just this chemistry that's going on and how the mind alteringness, if a mind altering effects from these substances change that, right? And so very often what you may find when your loved one has relapsed or you find them in active addiction, they may, sorry, that. They may be in a state of psychosis. Now, I'm not going to go too much into the detail of, you know, essentially, you know, what are the diagnostic criteria, but I think the important thing to think or just note around this is that it is unmanageability to the point of absolute extreme, to the point of real risk, right? This is when their risk of harm to self, others, is almost at its highest. And bear in mind that, you know, the function of this psychosis in many ways is to just escape. Now, I did mention we would sort of tackle what is this idea of escape, because I think we use it so much in relation to addiction to the point of we don't even know what it is they're actually trying to escape. And when we think about escape, what I really want you to think about is an escape from self in some sense, an escape from who they are, the reality of who they are, and where they are going with this, right? And psychosis is the ultimate level of escape from oneself. It's really the ultimate picture where one has no sense of self whatsoever. That's why very often in terms of psychosis, when we're looking at this, we're looking at, you know, um, can they relate to others? Um, can they relate to themselves? Are they orientated? Do they know where they are? What is the thought process? Can they follow a conversation? And what you find is, in this absolute state of psychosis, absolute state of um, real active or real active relapse, you find that there is no reasoning with this person because in many ways there is no person here. They've gone so far down this rabbit hole of escape that they're almost unrecognizable. And this is for me, and where I really wanted to speak to in terms of psychosis and relapse is firstly when they're at their highest risk, but also secondly, where they most need to be stabilized, right? This is the type of relapse where pillars, step programs, um, you know, family support, conjoints, none of that works. Their feet aren't on the ground right now. In many ways, they are just floating. They've escaped the ground, they've escaped gravity, and there is no pull. There's nothing holding them down on this earth right now. And so, the most important point or the most important thing about this kind of relapse or about this kind of active addiction is to get them stabilized. That normally looks like sending them to a primary care facility, one that works with psychiatrics, and very often because of the mind-altering substances that they've been using, this plays a huge impact on their brain chemistry. And so one of the most important things about stabilizing is making sure they're on the correct meds, and making sure that they've been assessed correctly in terms of past history, et cetera, et cetera. And this is where your role comes in so strongly in terms of collateral information, because they're not in a state where they can always provide the most accurate information. And so really the family and the biggest family role here is firstly getting them into some kind of treatment almost immediately. And the goal for that treatment is, 3 or 4 days, sometimes more, just getting them stabilized in terms of medication and really just orientating themselves again and connecting with some kind of sense of self or reality. And so, your role on that first basis is actually just taking almost full control there. If the risk is high enough, and getting them the primary care they need, but at the same time then providing these places with as much accurate information, providing us with as much accurate information as possible, so that they can be medicated correctly and eventually land. The on the plus side, in terms of if it's not dealt with accurately and not dealt with swiftly, these psychotic episodes can become quite florid. They can become a state of permanence. They can become almost to the point of schizophrenia, or they do very often lead to schizophrenia. Not all substances. I think in terms of just the research, weed is actually one of the more dangerous drugs in terms of florid psychosis, in terms of psychosis that lasts for a very long time, which is interesting because we think that is the most sort of safest drug in inverted commas, but in terms of this kind of mind state, weed can often be the most damaging and the most long lasting. But in general, these episodes can be treated, and they are quite brief when they are substance induced. But the primary concern here, the primary thing for us in terms of just actual treatment, we long past relapse prevention. We're just now in the stage of actual stabilization and getting them stabilized, because they are in the most current state of escape. They are in the state of escape where they're not even in touch with who they are. They've lost all sense of self. And so just from our side and from, I think just in terms of what you as the family can do in this, stage, is to actually just work with the professionals in terms of getting them stabilized, and then to just kind of try and get them stabilized, because no form of treatment can occur in this sort of state. Cheryl, I don't know if you want to add. I think
I would love to, because I'm
quite
so
a
glad you
good
raised.
understanding of this, and you've worked
I'm
with this
so
a lot.
I'm so glad you raised the weed, marijuana, cannabis. Because I think I also want to back this up with the family needs to understand what relapse is. We've gone through a whole amazing presentation, but it's also important to know that total abstinence from all narcotics, mood and mind altering substances, is what recovery is. They are required to take their prescribed medication by a psychiatrist who understands addiction. And I know we'll have Dr. Tia on again in the near future, and she can cover these topics. But when we see marijuana coming into the treatment center, we have deep empathy for our patients because it causes the most damage. Can be long-term, as Calvin was saying, it's a very difficult one to treat. And a lot of people go home and they say to their parents, I'm not going to use the crystal meth, the cocaine, but I'll smoke weed. That's a relapse. If they drink a drink, that's a relapse. If they abuse their psychiatric medication, that's a relapse. If they take the wrong pharmaceuticals knowing that it shouldn't be taken, it's a relapse. So relapse is not just only going back to their drug of choice. It's about finding any of those means to escape. And if they do cross addict and take marijuana while they've been addicted to crystal meth or coke, they'll be back on it in a very short period of time. So please don't let your loved ones manipulate you in thinking marijuana is safe. My clinical team, when we see it, we all hold our heads and go, oh, shame, no, 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 no. Because marijuana is that difficult to treat.
Just to back you up a bit on that, they did a very long-term study in Sweden around this. And so they had sort of a conscription for 18-year-olds, and they went through and they asked them quite honestly about their substance use. And being Sweden and Swedish people, they were actually quite forthright and honest about the extent of their abuse and such and such. But what they did then is they started looking at, they took all this information and they started studying these people over a very long course. And what they found is that weed is firstly, it plays most in terms of the genetic precursors of psychosis, because psychosis, as much as it can be substance induced, it also has a very large genetic component in the way the brain chemistry works. But beyond that, it's also it's one of the very few substances that can create a long-standing psychosis simply off of just one usage. It doesn't just take, hundreds and hundreds of hours of drinking, or many instances of usage. It can actually just take one usage, and if one is at the highest risk of going into a long-term psychosis with just one usage. So yeah, my advice in terms of recovery is to always stay away from weed and cannabis.
Yeah, we've only got about 2 minutes. So I want to zip through the 2 questions.
Sure.
I'm going to start at the bottom one first, because for me, it's very simple. Going to school reunion, is it advisable to take loved one with or not out of treatment? No. Simple, short and sweet. No, definitely, definitely not. Please talk to their counselors about what is safe, what isn't safe. They should have a sustainable recovery plan, and work with their sponsor and their group. The other one is continuous, and Calvin, we're going to have to answer this in a minute. Is continuous lying, i.e., a loved one has a history of lying about who they are in their life, linked to a psychosis or a symptom of psychosis? And can someone in the state actually own their recovery or fully be aware that they're an addict? I think we could do 12 hours of workshop on this.
And I mean, maybe just to answer very, very quickly, lying can be a symptom, but it's not the only symptom. And generally, in a real state of psychosis, they don't even know they're lying. Everything for them that they are saying you could put them under a polygraph is true because they're in such a state of non-reality that whatever they're saying in terms of reality, is so real for them. And then can someone in this state actually own their recovery or fully be aware that they're an addict? No, no chance. Not in this current state.
But I do want to say, continuous lying is a symptom of addiction. So if it's been around that long, once you do get your loved one into treatment and uncover, you'll probably find they've been using something since they were very young, particularly including cannabis. Lying has really two faces. One is a personality struggle, and the other one is addiction. 99.999% of addicts have had long, dishonest lives. They all lie about who they are, what they do. It's a symptom of addiction. There's lots of other psychiatric profiles and psychological profiles, but because we're in an addiction rehab, if your loved one is lying, probably has the disease of addiction.